Brown-Séquard syndrome is a rare neurological condition that significantly impacts the spinal cord. It specifically affects the spinal cord, which is a crucial component of our central nervous system. The spinal cord is a vital part of our nervous system, acting as a conduit for messages. It carries essential messages between the brain and the rest of the body, facilitating movement and sensation. This syndrome disrupts these critical messages, leading to various neurological deficits. This condition arises from damage to one side of the spinal cord, often due to trauma or injury. Imagine the spinal cord as a highway with lanes of information traveling up and down, constantly in motion. Brown-Séquard syndrome is like an accident blocking one side of this highway, causing a significant disruption. As a result of this blockage, the body experiences a specific pattern of weakness and sensory loss on one side. It's important to remember that this syndrome is rare, making it a unique challenge for medical professionals. However, understanding its complexities is crucial for timely diagnosis and effective treatment, ensuring better patient outcomes. Brown-Séquard syndrome occurs when there is damage to one side of the spinal cord. This condition can lead to a variety of symptoms, depending on the extent and location of the injury. This damage can be caused by various factors, each presenting unique challenges for diagnosis and treatment. Trauma, such as a gunshot wound or a knife stab, is a common cause. These injuries often require immediate medical attention to prevent further complications. Tumors growing near the spinal cord can also lead to this syndrome. These tumors may be benign or malignant, but both can exert pressure on the spinal cord. As the tumor grows, it can compress the spinal cord, causing damage. Early detection and treatment are crucial to manage the impact on the spinal cord. Infections like meningitis or spinal abscesses can inflame and harm the spinal cord. These infections can spread rapidly, making timely intervention essential. In some cases, Brown-Séquard syndrome can be a complication of other medical conditions. These complications can add layers of complexity to the patient's overall health. Multiple sclerosis can trigger an inflammatory response that damages the spinal cord. Managing such chronic conditions requires a comprehensive approach to care. Brown-Séquard syndrome presents with a unique set of symptoms that can be quite distinctive and alarming for both patients and healthcare providers. This is due to the specific way it affects the spinal cord, often resulting from trauma, tumors, or other spinal cord lesions. On the same side as the spinal cord injury, there is weakness or paralysis of the muscles, which can significantly impact the patient's mobility and daily activities. This is because the messages from the brain telling the muscles to move are interrupted, leading to a loss of voluntary muscle control. On the opposite side of the body, there is a loss of sensation, which can be confusing and distressing for the patient. This includes the senses of pain, temperature, and touch, making it difficult for the patient to perceive these sensations accurately. This happens because the messages from the body to the brain about these sensations are blocked, disrupting normal sensory processing. The symptoms usually appear below the level of the spinal cord injury, affecting areas of the body that are lower than the site of the damage. For instance, an injury in the neck area could lead to symptoms in both arms and legs, potentially causing widespread functional impairments. Understanding these distinct symptoms is crucial for early diagnosis and effective management, allowing healthcare providers to develop appropriate treatment plans. Diagnosing Brown-Séquard syndrome involves a comprehensive evaluation. Doctors begin by taking a detailed medical history. They ask about any recent injuries, medical conditions, and the onset of symptoms. A physical exam is then performed. This focuses on assessing muscle strength, reflexes, and sensory perception. Doctors look for any discrepancies between the two sides of the body, which are characteristic of this syndrome. Imaging tests play a vital role in confirming the diagnosis. Magnetic resonance imaging, or MRI, is particularly useful. It provides detailed images of the spinal cord, revealing any areas of damage or compression. Section 5. Treatment options. Restoring function and managing symptoms. Treatment for Brown-Séquard syndrome aims to address the underlying cause and manage the symptoms. In cases of trauma, surgery may be necessary to stabilize the spine and decompress the spinal cord. Medications, such as corticosteroids, can help reduce inflammation and swelling in the spinal cord. Pain relievers can alleviate the discomfort associated with the injury. Physical therapy is a cornerstone of treatment. It helps improve muscle strength, coordination, and mobility. Occupational therapy focuses on improving daily living skills and adapting to any disabilities. Section 6. Living with Brown-Séquard Syndrome. Adaptation and support. Living with Brown-Séquard Syndrome can be challenging. It often requires significant adjustments to daily life. Assistive devices such as wheelchairs, braces, and walkers can enhance mobility and independence. Support groups and counseling can provide emotional support and coping strategies. Connecting with others who understand the challenges can be immensely beneficial. It's important to remember that recovery from Brown-Séquard syndrome is a journey. It requires patience, perseverance, and a positive outlook. Section 7. Preventing Brown-Séquard syndrome. Reducing the risks. While not all causes of Brown-Séquard syndrome are preventable, certain measures can reduce the risk. Wearing seatbelts and practicing safe driving habits can minimize the risk of spinal cord injuries from accidents. Maintaining a healthy lifestyle can also play a role. Regular exercise strengthens the back muscles, providing support to the spine. A balanced diet rich in calcium and vitamin D promotes bone health, reducing the risk of fractures. Promptly addressing any infections or medical conditions that could potentially affect the spinal cord is crucial. Early detection and treatment can prevent complications. Section 8. Seeking help, early detection and intervention. Brown-Séquard syndrome is a serious condition, but early detection and treatment can significantly improve outcomes. If you experience any sudden weakness, paralysis, or loss of sensation on one side of your body, seek immediate medical attention. Don't ignore the symptoms or delay seeking help. Prompt diagnosis and intervention are essential for maximizing recovery and minimizing long-term disabilities. Remember, your health is your most valuable asset.